Preparing samples to be sent out to the outside labs. We typically send out most of our blood work and then all of our biopsies and cytologies to reference labs. Our main lab for sending out our blood work is Antec, and then for biopsy, cytologies, fecal samples, and other things, we use IDEX Laboratory. So for the blood work, you just type in what blood panel you want on the computer and it prints out the two forms. The biggest thing you want to do is, if it includes a urine sample, write the way you got the urine. So is it a void sample? Did you get cysto or catheter? That's very important because sometimes, extra red blood cells show up, or white blood cells, or different things show up, and the doctor just wants to know, is it actually a problem, or is it just the way the urine was collected? So you get these all set up. One copy of the paperwork goes to the doctor, and obviously the other one goes to the lab as well. So the copy that goes to the lab just gets folded and then put into the appropriate bag, and then your samples go in with it. Urine samples and all tubes should be labeled with the patient's last name, first name, and then we write what way we collected the urine on the tube as well, just to cover all of our bases. For this, use the lavender top for the whole blood, so that will give you your CBC and then the whole blood, and then we use serum separator tubes, which are the tiger tops from Antec as well. These we centrifuge down here to get the serum, so they go in our centrifuge right here, and they get spun down at 50 for 2 minutes, and then that will give us our serum sample. So we package all those up once those are done. Make sure it's closed tightly so there's no leakage or anything. And then these all samples go in the fridge unless we know our carrier is coming soon. If our carrier is not coming within, less than half an hour, then they automatically straight go into the fridge so that the samples can be kept as best as possible. For biopsies, to go to our lab, the surgeon who normally takes them, since that's how we normally get our biopsies, puts the specimen in the jar during surgery. They all get labels of all the pet's information, so pet name, patient's name, doctor, us, age, species, breed, and everything like that. And the doctor fills out the IDEX biopsy form. It has a brief history of kind of what's going on, like what the mass is and how it appeared, and then it has a chart so the doctor can locate where the mass comes from. If the doctor is sending out multiple masses, there's normally a tag on which mass is more important or which mass is which, so that the lab can identify it better. So it's pretty much the same thing. One copy goes to the doctor and the other copy goes to the lab. With biopsies though, these get separate. These do not go in the fridge. These are kept outside. And the good thing about these two is it has a special pocket for the laboratory work to go outside the pocket as well, in case there was, the formula was to spill or something happened. So the sheet goes on the outside of the bag in the pocket, and then you always want to make sure the lid is on tight for the specimen. And then it just goes in the bag upright as well, so that this is protected. And once again, these do not go in the fridge. These stay at room temperature until the courier comes and picks them up. We are going to do a quality control monthly rinse on our ProCyte CBC machine. First thing you want to make sure is that this will not interfere with any blood work or any status that you have going on in the hospital. It takes about 25 minutes, so you want to make sure that everyone is aware of that the machine will be down if you're doing it during business hours, or do it at night when you don't have to worry about having patients that might need it in an emergency, or surgery patients that have it going on. So first thing you want to do is you want to make up the solution. You want to use a 5% scented bleach and then some sterile water as well. You want to do about 5-to-1 ratio. So our ratio is 1.66 mLs of the bleach and then 0.33 mLs of the sterile water. You want to mix it together and put it in a tube that doesn't have any coating or anything on it, so we use the white tubes that we get from Antec. These are normally our urine or anything else, but these ones aren't coated with anything, so we put them in this. Next, we're going to go to our machine and our display and click instruments. We'll click on this ProCyte DX so that we can get that machine. That's the machine we'll be doing. We'll do quality control, and then pick that, and then we'll run QC so that it does it. This just tells us to make sure that we prepare our solution. We have that all ready, so that we know, and that we know the machine will be down for this as well. So we do next. And then that has it open, so it comes over here. And So that has that open, and it opens the little door for us. So we take off the top, put our tube in it, and put our top next to it so we don't lose it. And then we go back to our machine display and do OK, so that it starts, and then close the door so that it will run. And like I said, this takes about 25 minutes, so you want to make sure to do it at a time of where you're unable and you won't necessarily need the CBC machine for this. So we are going to run an ELISA SNAP heartworm 4DX. It tests for heartworm and then 3 tick-borne disease, so anaplasma, ehrlichiosis, and Borrelia, which is Lyme disease. The heartworm 4DX are kept at room temperature, so you don't need to take them out. Feline combo tests for feline heartworm, feline AIDS, and feline leukemia are kept in the fridge, and those need to sit out for 30 minutes before you run them so they can be brought up to room temperature. But these are already at room temperature, so you just take one out, open it up, so it'll have your snap test and then a little pipette. For the conjugate, you do 4 drops of this, so the best way I remember it is blue, has 4 letters, so you do 4 drops, and then you take your sample, and since the sample is whole blood, you do red, so you do 3 drops of your whole blood as well. And then you want to make sure it mixes together pretty good, and then you pour it in the little container on top. Now we have machines here that can run them. You can read them, let it flow, and read it manually, or we have machines that do it. So for us, we click on our machine. Ooh, I have gloves on. So, and which one we want to run it to. And then we turn this one, we'll use this, click on it, and then we select the correct 40x plus test, and we're using whole blood. You can also use serum or plasma too if you don't get enough. So you want it to run so it gets all the way through, and then as soon as it gets through this second dot here and seeing a little blood, that is when you want to snap it. This one ran pretty quickly, which is very good. So it's starting to come through, and as soon as it comes through, you want to snap it down, so then it's full half like that, and then we put it in our machine. At this point you can just let it sit out. It takes about 7-8 minutes to fully show the results, but then that way, once that's done, you can either manually read it or the machine reads it for us. This is Willie. He's one of our outdoor kitty cats. He has some allergies, so we were just going to check his ear cytology today. We're just going to leave him in the kennel because this is where he's more comfortable, and we want to make this at least a stress-free process. So grab your swab, and then you kind of want to hold the ear up so that you can straighten out that canal, and then place the Q-tip in his ear, kind of find it, ooh, I know when that itches, so that you can get a sample as well. That is his right ear, and then you're going to do the same thing for his left ear. Lift it up and then kind of just go back and forth, and it kind of itches. You want to break the left side so that you know which ear is which when you do the samples. For preparing our slide, you want to first make sure you have it, and make sure you have frosted side up. That will be the side that has the texture. Some people do it left by the frost, other people do Robert Frost or right ear by the frost, so just make sure everyone has the consistency of what you're doing. So we're going to take our left one, which is our broken squeals, because you break it into an L, so you know it's your left ear, and just gently rub it back and forth a little bit so you get a good sample on the slide, and then do the same thing with the right ear on the other side of the slide. And then we are going to heat fix our slide, so we take a lighter and just gently go underneath it, not getting too close, for about 5 seconds. And then I always just wipe off the back of the slide. And then we're going to do stain. So we get our clothespin, and we have labeled what side is up, so then you know once you dip your slide into the staining what side is up and what side is down. And then we have our 3 stains. So we do 12, 12, 24, the easiest way. you want to gently rinse it off with distilled water. You want to do it on the back side so that you don't get any of the material. And then to dry it, we have a central vacuum that you can use, or I like to use the bilious paper just to make sure that all my specimen stays onto the slide. So just gently rub it in between the bilious paper. And then I just wipe off the back of the slide to get off any excess water. For evaluating the ear specimen, you want to place the slide on the microscope and then start off at the lowest power field. Make sure to get it in focus, and I like to start off at a corner. Sometimes starting off at a corner is the best so you know your place as you get higher. Once you have it focused on the low power field, then you go up next to the highest power and do the same thing. You just always want to make sure you're getting it focused. As it gets higher, and then we're about to get to the oil immersion, so you want to make sure to place a drop of oil before you go on to the highest power field. Once you're on that field, you don't want to go back in the same spot because you don't want to get oil on any of the other lenses, because that can cause some distortion and make it difficult to use the other lenses. So once you have it in focus, you kind of just want to look around fully, look at the slide, see if there's any bacteria, any yeast, or any other debris. If it's a really bad infection, you want to make sure there's no like white blood cells or rods. Looks like Willie just has a little bit of yeast so far in his ears, a bunch of waxy debris, some epithelial cells. So you just want to scan and make sure there's nothing too bad, or kind of consistency of what you see in his ears. So yeah, so far, small amount of yeast, about 3 to 5 yeast per field, cadmium cocci, and then just a lot of waxy debris built up in his ears with some epithelial cells. So you'll relay this side to the doctor and let them know what's going on, and then you do the same evaluation for the right ear as well to see if there's an infection going on in both ears or is it one ear, and kind of evaluate what you need to do for further treatment. This is our supplies for our necropsy. So we have our gown, our goggles, and then we keep gloves in here as well for all of our PPE. And then we have our scissors, our knives, our blade, our saw cutter to help open up the body, biopsy jars for when we take samples, and then blade holders so the doctor can cut the midline, and then suture material and needle drivers so the doctor can close the body up. Okay, so we are about to do a necropsy on this little patient who unfortunately died of unknown causes. So we have everything all set up. We have our PPE, which includes our gown, our goggles, and all of our supplies and our gloves. So we're going to go ahead and put those on. We want to make sure to wear all these things just to make sure that we don't get any bodily fluids on ourselves, just because we don't know what the dog died of. So we want to make sure to protect our clothing and then any cuts or anything we may have, our eyes, so that we do not get any fluid into any orifices and possibly may contract any diseases. We will put all these on. Put on your gown, and then your goggles, and then your gloves. And then this just helps make sure you keep cleaning and don't have any cuts or anything like that exposed while you're dealing with the body cavity and then body fluids, especially too, because you will be taking biopsies. The doctor will come and do a full external exam, and then we'll cut along the midline. So we'll cut along the abdomen, kind of take around, and then take a couple biopsy samples. So the doctor went ahead and took 2 biopsy samples. We found this internal lump, so we went ahead and carefully placed that in a formalin jar, and we'll send that out. And then we found another piece of the liver/spleen. So then of course this one's already labeled, and it has the pet's name, information, everything, and then why we took it. So when dealing with a possible rabies positive case, you always want to make sure that only rabies vaccinated people are handling it. So there's definitely any of the doctors, that any technician or other staff needs to be rabies vaccinated to be able to hand that, just in case it does come back rabies positive, you're not having more exposure than necessary. Also, once the pet is deceased, the doctor is normally the one who cuts off the head, but anyone dealing with it, including the doctor, needs to be wearing the appropriate PPE. So that includes gloves, gown, mask, and goggles. Rabies is transmitted through saliva, so you want to make sure that you're covering all your bases, that you're not to be exposed to that and not to get anything on you. Once the doctor has cut off the head, it is packaged up into a biohazard bag and then put in a box to be shipped off to the lab in Kansas. You want to put it in the fridge and not the freezer. That is very important. You do not want the head to go into the go into the freezer if it is being tested for rabies. The rest of the body can be packaged up as normal for communal cremation through your whatever crematorium that you use. We have had special cases that owners want ashes back, so that has to be set up specially for the owners to receive their ashes back. Otherwise they just go in with communal cremation and out to the lab. Once that is packaged up, and once the head is packaged up and in the fridge, it gets sent out to the lab. Okay, collecting a vaginal cytology. This will help determine what estrus they're in, so for breeding purposes it's really good and a really good way to get it. So you want them standing, and you want to lift their tail up. First, like any cytology, you want to make sure you clean it and wash it. So we have our scrubs there. So you just want to kind of wipe the vaginal area off, and then you can get your wash and do a thorough rinse of it. This will get off any debris or anything like that. Next, you want to take your sterile swabs, moisten them with the sterile saline, and then you want to insert it and then go cranially to get your sample. Try and be as gentle as possible as always. If they struggle too much, take a break and then you can try it again. So that then you go cranially. You don't want it to be moistened so you don't damage any of the cells. And then when you get your sample and on your Q-tip, you want to slide it gently. Once again, not to damage any cells or anything like that. For our vaginal cytology, to fix it too, we're going to spray some Cytofix on it and let it sit for about 2 to 5 minutes. You don't want to hold it too close or too far away, and you just want it to be able to get dried so that all the cells stay on the slide and you can correctly read your cytology. After the 2 to 5 minutes of drying, you're going to stain your slides. So you're going to go ahead and move them through your stains. Do 12, 12, and 14. So 4, 6, 12, 1, 2, 3. And you want to gently rinse it with with distilled water, and then gently press it on the bilobus paper so that you don't disrupt any of the cells or damage them. So when looking at the vaginal cytology on the microscope, you want to go through your motions of going through the microscope. So starting at the lowest power, focusing it on something on the cells, and then moving up slowly to the higher powers. You want to make sure to go through all the stages, and then when you get to oil on your high-powered field. You want to make sure to look through at least 10 fields so you can accurately diagnose what cells and what stage of she's going through in her reproductive. So here it appears Carly is going through anestrus stage. There are 4 stages: anestrus, estrus, proestrus, and metaestrus. There's no vulvar swelling, so she's not showing any signs of that, and mainly seeing non-cornified squamous epithelial cells. If she was going through proestrus, there would be vulval swelling with some reddish discharge and then on the microscope slide, there would be high numbers of erythroid cells along with basal and parabasal cells. In estrus, there's more of a swollen vulva, pink to straw-colored discharge going towards whitish discharge as she gets closer to metaestrus. On the vaginal cytology, there will be cortified squamous epithelial cells, not really any neutrophils, and a small amount of erythrocytes may be present as well. Finally, on metaestrus, there is vulvar swelling. Discharge is gone down and slowly disappearing, and it's gone to non-cornified squamous epithelial cells with a lot of debris kind of going on as well. There are not really any erythrocyte cells present, and neutrophils increase for about the first 3 days and then decrease around day 10. For starting for cross-matching, you want to first draw a lavender top and then a serum separator tube from both your donor and your recipient patient. Spin down the serum after it's clotted and then separate it and put it into plain red tops. After that, you'll spin down the whole blood so that you can get plasma and then take the plasma off that. After centrifuging down the plasma, you'll want to decant it by taking out the plasma from the whole blood, so that way you have it separated. And then you'll take a little bit of the whole blood, place about 1-2 drops into new one, and then fill the rest of the tube with saline. You'll gently mix this and then continue to centrifuge it for about another minute at 3,400 RPMs, and then you'll do this about 2 more times afterwards. After the first time of mixing the whole blood with the saline, you want to spin it for about another minute at 3,400 RPM, and then do that about 2 more times until the liquid is clear, so that the erythrocyte cells are thoroughly washed and indicated. After that, you're going to take 0.2 sample of each and then mix it with 0.02 or take 0.02 mils of the packed cells and then mix it with 0.98. So you get a mil total with saline of the cells so that they can be thoroughly washed, and you can use them to do a major match and a minor match. Each of these tubes already have the 0.98 saline in them, so we're just adding in the 0.02 of the cells and then gently rocking them and mixing them, making sure that all things are labeled correctly so that the correct samples stay with the correct samples. To check for auto-agglutination, which is the major thing when cross-matching, you want to set up 2 controls. So you'll have 2 separate tubes that are labeled controlled for each patient, and you'll mix their own serum with their own suspension, and it'll be 2 drops each. So for our first one, it's 2 drops of the serum, which will go with 2 drops of the suspension. It's from the same patient because this will be your control. And then for our other patient, same thing. 2 drops of their serum, mixed with 2 drops of their suspension. And now you have your controls, so you can check for auto-agglutination. To do a major cross-match, you're going to take the recipient serum get 2 drops of that, place that into a tube, and then get the donor cell suspension and place 2 drops of that into the same tube. And then gently mix them together. And then this is a major cross match. To do a minor cross match, we'll get the donor's serum, get 2 drops of that into a new tube, and then the recipient's suspension, mixed to that with the donor's serum, place that in a new tube, 2 drops together. And then mix those gently together, and that's a minor cross match. After all of your samples are made, you want to gently rock them all and then set them on a rack so that they can sit at room temperature for about 30 minutes. After 30 minutes, you're going to spin them for 1 minute at 3400 RPM. You want to check your control slides first. If you have auto-agglutination on the control slides, that means that you're not going to be able to interpret the minor and major cross-matching. So the control slides were clear, however, I've looked at the major cross-match and there is some auto-agglutination, so these two would not be a good candidates for transfusion between each other. Skin cytologies and skin scrapings. So this is common to do when you look for mites. Carly here has a little bald spot on her leg that seems to be growing a little bit and getting a little bit worse. So we're going to check it to see if she has Demodex or sarcoptic mange or mites living in her skin and see kind of what's going on. So to do that first, we're going to get a slide and put a little bit of mineral oil on it. So we have that. And then we have our 10 blade that we're going to put in the oil so that it gives us a nice lubrication for when we scrape the skin. So kind of you want to cover the blade in the oil a little bit. So this is going to be on her front leg. Can I have your leg? And we're kind of going to just scrape the area a little bit. You don't want to do it too hard, but you want to make sure that you get the skin follicles up. And it's kind of going to make it look worse than it looks better, just because you want to get underneath those hair follicles to make sure that, because that's where the mites live. So we took 1 sample and we'll kind of just put it on a slide. Come here. And then we'll get another sample. Hey, come here. Can you see your leg? So you just scrape that area. It will bleed a little bit, and that's okay, because like I said, we want to get the skin follicles. So we'll put this on the slide, the oil. We're looking, like I said, we're looking for mites. So we'll look under it, and depending on what we find, if there's what type of mites or kind of what different kinds of mites, that will do our treatment. Sometimes you find no mites, but based on characteristics, you know, we'll still treat for mites, and sometimes that will be the resolution. Demodex is sometimes hard to find. It's very common in puppies, and so it's just you're looking for different things and kind of putting together different symptoms with what you're seeing. When getting your tubes out of the centrifuge, slight hemolysis in dogs is not that significant. So you want to set up your prep slides. You want to do 1 for each control, and then 1 for your major and 1 for your minor. So just take a drop, put it on the slide, make sure to label which one is which, and then put a cover slide over it, and then do that for each one.